When a patient receives a cancer diagnosis, it impacts them physically, emotionally, and spiritually. The support system plays a very crucial role in their cancer journey. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. We're focusing this month on breast cancer awareness. This week, we're talking about how a loved one can provide support for a family member or friend diagnosed with breast cancer and the most important thing a support person can do. I'm here today with Dr. Katie Harry, a licensed psychologist with St. Luke's Cancer Institute. Thank you so much for joining us.
Of course. Thank you for having me.
So, Dr. Harry, how important is the role of the support system for someone who's been diagnosed with breast cancer?
It's really integral to going through treatment. No one wants to face this alone. There's really two pieces of support. The first is tangible support. So providing rides to appointments and providing food and helping the person get around. And then the emotional support. So sitting with them while they're at treatment, being able to express what it's like to go through this and to hear them out if things are emotional or they're worried, and really just to be able to talk about things that aren't related to cancer and really just spending quality time.
Yes. So focusing on the emotional support, some things we say to those with breast cancer out of love can actually be triggering. What are some of those common things that you hear, and what can support people say or do instead?
So best rule of thumb is open communication. So really asking your loved one what would be important or how can I help? But yes, there unfortunately are things that they say that can be very emotional. Things like, you will be fine. Although this is meant to be helpful, can really be very invalidating. Going through breast cancer is very difficult. There are some very raw emotions involved. So being able to acknowledge those first, instead of jumping to reassurance, validating those emotions can be very helpful. The other thing is you should be positive. It wouldn't be realistic to ask anyone to be positive all the time, but especially while you're going through breast cancer. So really trying to balance being hopeful and positive while also acknowledging the really raw emotions that come with it. Also saying, it's just boobs, or you will get a new set. We wouldn't say this about any other body part. There is a lot of female identity and loss associated with losing our breasts. So having to be able to have someone that can listen and hear them out can make a big difference. The other thing is when you're done with treatment, people often, their support system is very strong in the beginning and then it dissipates. And people are ready for you to move on, although treatment may be over, you may be in remission, but a lot of hormone-positive breast cancer patients are continuing to take medication for up to 5 to 10 years later. So really trying to check in, even with patients when they're in remission, can be very helpful. Lastly, one of the things that patients worry about is fear of recurrence or fear that the cancer will return. Most of the time, family members will say, you're fine, don't worry about it. Again, this can be very invalidating. They're worried about these things. These are very normal thoughts and concerns. So really trying to be a listening ear can make a huge difference.
Okay, those are all great points. Now, how important is it that patients do feel supported?
It's extremely important. Oftentimes, thoughts or concerns in our brain take on this very heavy quality. Being able to express them verbally or in writing can make a big difference. They tend to take a little bit of a lightness and a different perception if we're able to talk about them with our loved ones.
Okay. So what should support people know?
The best thing to do is the overall message is, I love you, I care about you, and I'm here for you. To really trying to set an intention to hear the person out and to be a listening ear. We are natural problem solvers. We want to jump in and fix things when someone's upset. But sometimes that is not what's needed or warranted in those situations.
Now, is there anything else you want to add today for people who are watching?
I think a big thing is for caregivers and loved ones is to also take care of yourself. It can be very emotionally draining to take care of our loved ones, and we sometimes forget that our own self-care is very important. I often give the analogy of a mask on an airplane. That ask you to put your oxygen mask on first before you help someone else. This applies here, making sure that you take care of yourself so that you can be there for a loved one. And also, cancer patients often express, I'm worried about my loved ones. They're taking care of me. What about them? So you can also help by taking care of yourself.
Okay, great. Well, thank you so much for joining us today, Dr. Harry.
Of course.
To learn more about St. Luke's supportive oncology and rehabilitation services, visit stlukescasey.org/supportive oncology. Next week, we'll be joined by Dr. Tim Pluard, the medical director for St. Luke's Cancer Institute. We'll discuss the latest treatments for breast cancer and some exciting developments on the horizon, including the possibility of a breast cancer vaccine. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukescasey.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.